name is Tiara Green, and I'm an ECU DNP student in Nursing 8271. I'm here to talk about Health Information Exchange, or HIE. Health Information Exchange allows the healthcare interdisciplinary team and patient to access and share the patient's medical information through a secure electronic system. Information can be shared electronically across the state or even nationally. Sharing of patient information appropriately and in a timely manner allows the provider to make better decisions by avoiding hospital readmissions, avoiding medication errors, improving patient diagnoses, and decreasing duplicate testing. Health information exchange also improves the quality of healthcare, reduce the cost of healthcare, increase patient safety, and improve the overall patient's healthcare outcomes. There are three key forms of health information exchange, which are direct exchange, query based exchange, and consumer mediated exchange. Direct exchange is encrypted, secure way used by providers to send patient results, referrals, or discharge summary to another healthcare provider. Query based exchange is used by providers to find or request patient information from other providers related to unplanned care. Consumer mediated exchange provides patients with access to their health information, allowing the patient to be in control and allowing them to actively participate in their care coordination. Health information exchange does not replace provider patient communication. Health information exchange as it relates to federal legislation. In 1996, commonly known as HIPAA or Health Insurance Portability and Accountability Act was implemented. It provides privacy and security provisions for safeguarding individuals' medical information. In 2009, Health Information Technology for Economic and Clinical Health Act, or HITECH, was implemented. This was a process of supporting technology in the U.S. with the adoption of the electronic health record. Medicare and Medicaid HIT gave financial incentives to healthcare professionals and hospitals that adopted the use of electronic health record technology. So, what does this mean for North Carolina as it relates to healthcare information exchange? Well, in 2015, a law was passed in North Carolina called the North Carolina Health Information Exchange Authority, or NCHIE. It was created to oversee the North Carolina Information Exchange Network, which is called North Carolina Health Connects. It requires healthcare providers who receive state funds to connect to North Carolina Health Connects. There was a deadline implemented as of June 2019 that all North Carolina licensed healthcare providers and organizations were required to submit clinical and demographical data to North Carolina Health Connect. As of June 1, 2018, physicians, physician assistants, nurse practitioners, except psychiatrists, should have been connected to Health Connect or received an extension if services are provided through Medicaid or state funds and have an EHR or electronic health record. Two recommendations for advancing implementation of health information exchange in North Carolina or improving North Carolina Health Connects. One would be acceptance from the patient and the provider. And the second one would be funding for rural health clinics. Acceptance from the patient is a plus. The patient needs to be willing to utilize the healthcare information exchange to obtain healthcare information. The patient has to be well educated about the process, and as well as the provider. The provider has to be willing to use the healthcare information exchange and be willing to accept change and not being able to use a paper chart. Rural funding. We need rural funding so that the rural clinics can connect to bigger organizations that have healthcare information exchange or utilize electronic healthcare records. Last but not least, always provide education to patients about the use of health information exchange related to electronic health record to reduce any fear of utilizing the system. Thank you for listening to Health Information Exchange from Tiara Green.